All right, we're going to go ahead and get started with the new technician initial training. Welcome, everybody. Again, please keep your phones muted until after. A little overview of today's training. We'll try to be brief, but I want to not miss anything. Again, if you have questions, write them down, or if I'm going too fast, just write them down and we'll review it at the end, okay? So here we go. First thing, we're going to talk about a little bit of the company structure, Medicare, Medicaid overview, a little tour of the company website, how to pre-qualify patients and how to qualify them, the required paperwork that's involved in running the tests, the forms, how to collect the patient samples, how to swab, what to do with them after you collect it, and how to report your production and successes in the field so you can get paid. Managed medical testing is separated into three arms. We have our Medicare, Medicaid, and retail arms. You'll see some kind of structure underneath each category. The Medicare and Medicaid, which are the insurance-funded programs, have kind of a hierarchy. They're a flat rate compensation, and so we have our genetic testing technicians, our state and territory managers, and our regional managers. On the retail side, you'll notice there's no hierarchy. It just simply says genetic testing technicians. That's a different commission schedule. Again, this is an optional participating thing for this company. If you want to make a little extra cash, this is the way to do it. This is actually a percentage of the retail price of our tests, and that currently is at 20%. The insurance funded testing. As of today, April 17, 2019, we're currently offering 2 Medicare and Medicaid funded tests. Now, the Medicaid states have been restructured a little bit this week. We'll go over that in a minute. So we're going to concentrate on the Medicare program today. Medicaid is very similar. However, all the qualifying factors for Medicaid are the same as Medicare, just state dependent. Medicare, however, you have to be 65 and older to be on. Medicaid, you have to be 18 and older. So that's that's a major difference, actually. So the first test that we offer is the PGX test, and that's the pharmacogenomic test, and that's the one that deals with the drugs. The second test is the cancer genomic test, or the CGX, and that's the one we call the cancer test. The other one we call the drug test. The cancer test is not a cancer screening for if you currently have cancer. It's a screening to see if you can receive hereditary cancers or pass them down. Next Wednesday, we're going to open up the 3 additional Medicare and Medicaid tests. They're going to be a cardio test, an Alzheimer's, dementia, Parkinson's test, and in the Medicaid states, a beacon carrier test. So to pre-qualify for these programs, our program that is, the patient has to have Medicare Part B or Medicare Advantage, and it has to be a PPO. We'll talk about the differences in a minute. If they have an HMO, not a PPO, that doesn't mean they don't qualify for the no-cost testing. It just means that we can't offer it to them in the field. They're going to have to go consult with their doctor. Medicaid is approved in certain states, and those Medicaid cards cannot reflect that it's an MCO. Again, we'll dive into Medicaid in the future for those of you who are in Medicaid states. Right off the bat, we got to talk about this. Medicare and Medicaid fraud, it's bad. I think that's all I have to say about that. Don't do it. We'll report you ourselves. That means no kickbacks to doctors, no asking people, if they want a free pizza, then you give them a test. It's nothing like that. We don't do any incentivizing whatsoever. HIPAA, you wouldn't be in this training class if you didn't have the HIPAA certification, so just know that we're HIPAA compliant. This is kind of important. There's 2 different types of Medicare cards out there right now. This one back here is the current one, and this is the new one that's coming out, and a lot of people have them actually. So either of these 2 cards is what they'll need to be presented as their Medicare proof of insurance. Some people will have an AARP card. That's not going to work. It has to have this card because what we're looking for, even though they have to have Part B coverage, we need this date, this Part A date, because you cannot have Part B without having Part A. Now, if you don't know the different parts of Medicare, there's some video in the training section. But really quickly, the ones we're concerned with are Part A and Part B. Part A is your hospital stays, and Part B is your doctor's office visits. These are the current Medicaid states. There's current Medicaid cards for those states. Again, more focus will be later in the future for those Medicaid people. We have some key terms here. Doctor, I think everybody knows what a doctor is. But when we are talking about the doctor, we're talking about our doctors, the one of over 50 that we have that will actually order these tests for us. And we're not speaking of their primary physician. The laboratory, that's where the swabs end up going, the samples. And Ascension, goofy word. What this is basically, it's important to know this word. It's when the laboratory gets the DNA samples, they run a preliminary test to make sure that there's enough DNA and that there is also, it's viable. Another couple, swabbing. Sounds silly to have this one, but basically when we're talking about swabbing, we're talking about using a certified sterile device to collect the DNA from the client. Now, you're not going to be sticking the device in the patient's mouth. You're going to be handing it to them. And if there's someone that cannot do it themselves, you need to go ahead and call into the company management here, and we need to have a discussion before you do such a thing, because it's a whole other animal when you're touching people. Quality control, simple term. That's basically where the whole thing gets processed. Make sure everything's spelled right. Make sure that they meet the criteria before we even send it off to the doctor for their approval. Pharmacogenomic testing, PGX, it's the study of how genes affect a person's response to drugs. And so the test that we offer is going to reveal just that, how their actual body is being affected by the medications that they're on, what medications the doctor should maybe reconsider or consider an alternative for, give them some guidance in their diet. It's a really, really good test. Prescription error is the third leading cause of death in America right now, medical and prescription error. And so that's why this test is very important. Cancer test. Again, it's not a screening to see if you currently have cancer. It's a screening to see if you're susceptible to receiving hereditary cancers or passing them down. Personal history and family history. Personal history. It's exactly just that. Do they have or have they had cancer in their past? Now, personal history cancers are needing to be for them to qualify. Anything that's not an environmental cancer that's coming up. Family history, we can go 3 generations up or down. Family history cancers, they have to have at least 2 people that are blood relatives that have qualifying cancers on either side, mix and match, for them to qualify for the CGX test. So how we qualify a patient? Well, you have to have that Medicare coverage, like we discussed, and we're going to go step by step how to do an application here in just a few minutes. PGX prescription testing, a couple requirements. They have to have at least 2 prescribed medicines, and they have to be from 1 or 2 or 3 of these categories. It can be a mix and match. So what this is meaning is that blood heart medicines like cholesterol, high blood pressure, thinners, that falls into the blood heart category. Chronic pain, it's got to be chronic pain, not an acute pain. Psychological, like ADD, depression, anxiety, those types of medications. So they need 2. So 2, and they can be from any of these combined categories. So they have 1 from here and 1 from here, they qualify. If they have 2 from here, they qualify, or 2 from here, it's just they have to have at least 2. The cancer test qualifications, again, personal or family history. Personal history, anything other than an environmental cancer. So that's the exceptions to qualifying are lung, skin, lymphoma, and leukemia. The reason being is that this is a hereditary test, and lung cancer is not passed on from generation to generation as they know of today. And lung cancer can be avoided. So even if someone's never smoked a cigarette in their life, they have lung cancer, they were exposed to an environment that could have been avoided. Melanoma. It's a form of skin cancer, but it's deadly. That is the exception to the skin cancer rule. Melanoma can be a qualifying cancer. I'm going to pass through this one. Medicare and Medicaid both are the same when it comes to this. They have to have 2 in their family history, but you cannot have a opposite gender only cancer as a qualifier. That can be listed on there and considered and get them approved, but it can't be the only qualifying cancer. For example, if you have a female patient and they have a male relative in the first, second, or third generation that has a male genital only cancer, testicular cancer, that would not be a qualifying cancer. However, if you had a male patient that has a female relative, that blood relative that has breast cancer, that would be a qualifying cancer. The major cancers that they're taking a peek at are breast, ovarian, colorectal, pancreatic, prostate, and there's many more, but here's a few more on the right. Bladder, melanoma, again, is an exception to that, skin cancer, testicular, thyroid, spleen, brain, liver, kidney, fallopian tube, and stomach. Again, those environmental cancers, skin, lymphoma, lung, and leukemia, those are disqualifiers. Okay. So the way that we're going to find out if they have actual qualifying insurance is going to be to actually check them out through Medicare.gov. And we do that by going through our agent portal. So before we get into the step-by-step, I'm going to go ahead and bring over the agent portal so we can just take a quick tour of the website. Hopefully everyone is taking a peek. So, of course, you have our home screen. And keep an eye on this and check it frequently because you may notice there's several changes and there may be really drastic ones coming up. But any changes that we make are to benefit the people, make it easier to function. So the home page gives us our advertising there. And also, if you recall, you click on these squares, it'll take you to some PGX video, a cancer video, and then there's also some information on our retail tests. Again, not required to pitch the retail stuff. It's just a means for you to make some extra money and help those people out that you run into that aren't going to qualify for the no-cost test. We have our test menu. And as you can see, we're getting ready for the cardiac, Alzheimer's, and the beacon carrier screenings. Here's our prices. We periodically run sales. Again, that's 20% of the retail price that they're currently being sold at. Pretty excited about there's a new test here. Where is it? Well, it's not on the menu, but it will be in the store. Okay. Here's the store. This is where they can go ahead and you can assist them to purchase their retail tests. We have a new cannabis test, very interesting. The way that these tests would work is if they wanted to buy one and you were sitting there with them, you'd basically just point them out here and you'll put your code in. And that's how we keep track for commission purposes. And then they can just follow through with their checkout. So let's get into the agent portal. So by now you've probably figured out that when you go to check your email, it takes you through a pretty basic inbox. There's also instructions, it should be the first mail that you receive on how to add, or the settings for you to add your Advantage Medical email to your phone or tablet or computer. Company calendar. You can see that there's instructions here. In the future, you may not see these instructions posted for every meeting, but some people still can't figure it out, so maybe we'll continue to do it. This is how you got on here today, and this is the instructions. Okay. Now, we've got initially wanted to roll out scrub orders here this week, but the more people that jump in on the scrub order, the better price we all get. So we're pushing that back a week. And that'll be for scrubs, lab coats, that kind of a thing. And as always, of course, there's your business cards that that you guys should order. And the company store is linked to this. And so you can order your logoed apparel, marketing materials, business cards, so on and so forth. Okay. Now, this next section of the site is going to be where we're going to go to work here in just this minute to go through some testing and how to do it. Also is the swab packing slip and the production report links. There's also some information here, TeamViewer. If you have a laptop or a device where TeamViewer works, I highly encourage you to download TeamViewer on your device so that way if you're in the field and you're sitting with somebody, we can actually assist you in real time instead of having to send you back there. There's some brochures, some scripting, some logos. And there's also some training information. Look for some current videos there. This will be replaced with today's training, some swabbing instructions, a video on what nutrigenomics actually is, since you're going to be asked those types of questions. Okay. So first off, we talked about Medicare. HMO. HMO means that the network that they're in actually dictates what doctors they can choose from in a certain network. PPO is a preferred network program where they can actually choose where they want a doctor. So being that this program is not being completed with a laboratory necessarily in their areas, the PPO is what's important to have coverage for, to qualify for our field tests. So the way you're going to do that is, here comes the portal again, Medicare coverage verification. There's not one of these for Medicaid, by the way. It's just for Medicare. Zip code. You'll enter the zip code that you're in if that's where Medicare thinks that they live. If they're in Colorado and they give you a Colorado zip code and you push and you go through the whole form and all of a sudden it doesn't work, first thing to check is the zip code, because they may not be living where Medicare thinks they're living. So if that happens to you, just ask them, so where did you move here from? And then they'll give you that old zip code, and that should work then. Keep in mind that most forms that you fill out, the Medicare number is right on the front of the card, as you can see. It's right there, circled. Okay. You'll see here, look at this, I want you to pay attention to. The date of birth, for example, if someone was born on 4/28/86, it shows here, normally you'd want to put 0/4/28/1986. Well, Medicare's goofy. They want that month to be a single digit if it's a single digit, but yet the day of their birth is a double digit. Keep that in mind. So then what will happen is after you click all of this, you fill it out, then what you'll see is this screen. It'll ask you for a county. Again, it'll be the county that Medicare thinks that they're living in, not where you're necessarily sitting. So you have put in the zip code, their Medicare number, their last name. See how the date of birth, it actually worked this time, but normally it doesn't. It's 9, not 09. And it'll give you the county, and you'll hit continue. And then it will list, all we're worried about on this page is up here, right here, that's it. We're looking for it to either say PPO or anything else other than HMO. So if they have a PPO, it may not say PPO, but if they have an HMO, it for sure will say HMO. HMO means no, but anything else other than HMO in this field here works. That means that they'll be qualified. We use a couple different swab types. There's one that's in the page. It's a very common one. It's the OraCollect DX swab. It's a blue or purple is what we call it, blue or purple sometimes. This particular swab can be used for all insurance-funded tests. Okay. We have another less expensive swab that we are starting to send out that can only be used, the white ones, for PGX only. And you'll know the difference between these two swabs right away, because the cheaper swab doesn't have a label on it to label things. So we'll talk about that. Okay, so before we learn how to swab people, let's go through now. So you've checked on Medicare.gov. You've seen that they have qualifying coverage. And now what you want to do, since you have that Medicare card in front of you, you want to somehow capture an image of that card, front and back, and put it on your device temporarily, because you'll have to upload a copy of that with the application. So while you're at it, go ahead and grab their state-issued ID card, and all you need is a picture of the front of their ID card. If you're going to use a tablet and you take a picture with your tablet, make sure that it's clear. So if you have to take a couple pictures to make sure you get a good image and you can read all the numbers, then go ahead and do it. Same thing with the Medicare card. So remember, ID card, front, insurance, front and back, because that's going to come up here. Now, we're going to assume that you're doing a combo, which is the PGX and the CGX. So we're going to go ahead and scroll on our agent portal down to combo application. And that's going to bring up a form. Now, some of the other forms that we used to use, and somebody on the call may have seen other forms, were a little bit more complicated. So we've tried to keep it easy. And after we introduce the new products here, it'll be very similar to this as well. It'll actually be the same up top. So this right here, you want to make sure that all of your letters that you type in characters are in capital. So the form will not let you complete it if you mess something up, so you don't have to worry about it. So basically, it's the first name of the person, middle initial, last name, and you'll fill out all the other vitals. Okay? Here's where you will put your name and your ID number. Insurance provider, it's always going to be Medicare, and you'll put in their insurance number. Now, I'm going to scroll down the sheet, and then I'm going to scroll back up the sheet to check for corrections. I don't have the patient sign until the end. So you'll see several fields here where a signature box pops up. Again, remember to have them sign at the end, because they'll only have to sign one time. And they'll have to initial one time. But I want to get through all the important stuff first. You'll put the state that you're sitting in. Again, there's a signature. Skip it. So we do the PGX information first. Height, weight, allergy list. And it's really simple, because you just ask them these questions and they're yes, no's. Then it comes down to their medications. Again, all capital letters and everything. And so if they've got 25 medications, they will not fit on this list, but they will fit like 16. So I don't expect you to put down 16 medications, but here's what I do expect. If they're on a bunch of medications, have them tell you what they're for, write them down, and look at the bottles or their sheets and make sure you spell everything right. But then pick, if they say they've got 5 heart medicines, they've got 5 chronic pain medicines, they've got 5 of the psychological group medicines, pick like 2 or 3 from each category, and that's all you need to do. Now this is going to be also over-the-counter stuff. So ibuprofen, aspirin, baby aspirin, that kind of thing. Vitamins, multivitamins, not so much. Don't have to worry about that. But you can list them if you'd like to. So here's basically what you're going to do. You're going to put down the name of the drug, make sure it's spelled properly. There's actually in the agent portal a place to look at a list of the most common drugs that are prescribed if you want to have a copy of that at the ready. Or you can look them up online with another window in your browser. So let's just say that they're taking in, 25 milligrams of this stuff. So you want to know what they're taking in the dosage if possible. It doesn't have to be 25 milligrams a day or 3 times a day, nothing like that. Just basically the amount of the active ingredients that's listed on the label. If they know it, if they don't worry about it. You do need the name of it, though, spelled correctly, and you do need to know the reason why. So we're going to go ahead and put on here anxiety. However, some of the reasons that they may give you for a certain drug, like they may say, for example, Wellbutrin. And then they will put on here nicotine cessation or whatever. Wellbutrin is a depression medicine, but a lot of times this medication is prescribed for smoking cessation. And they have found that the off-label uses now are being more and more common and current. So just write down even if you know what Xanax is for, and they tell you it's because they have a chronic elbow pain, whatever, write down what they're telling you, because that's what they think they're taking it for. And you'll go down the list, and then you'll fill them in. Okay, there's the second list, or second column for you. And that's it for the PGX portion of the combo sheet. Now, you're going to get into the cancer part. And again, this is if they've qualified. If they haven't qualified for the cancer test, then you're in the wrong form. So you'll ask these questions. And when you get down to the family cancer history, it says if the same relative has had more than one cancer, please enter it on multiple lines, because that actually counts as qualifying. Here's the example. So let's just say now let's add one. I have Uncle 1. And he's on the paternal side. And he had brain cancer. Well, see where it says location? It may sound silly, but put brain again. And the age at which the person was diagnosed, if they know it. If they don't know it, try to get them to round it. If they don't know that, then have them make a call and find out from a family member when Uncle Johnny got brain cancer, and somebody will know. And if they don't just make up numbers, but you don't have to be exact. But there's a difference between getting brain cancer when you're 30 and when you're 60. So we do need to narrow it down. And you'll just keep plugging away till you run out of room here. So we'll say that this one here is another aunt, and that on both sides of the family, and they had breast cancer. Again, you try to figure out what they had, and if you don't know, just put breast. Okay, and they were 50 when they had that diagnosed, and continue to flow. Now, depending on the cancers, that this is for personal history now of cancer. Here's the different boxes that you will check going through for the particular cancers that they for personal. Down here is just lab stuff. You don't have to do anything here. Again, another signature. And you can see some initials. Again, just keep flowing by. Now when you get to this part, this is where you're actually going to take those images from your stored device and you're going to insert them. I like this one. And you're going to do it again for the back of the insurance card. This is for the front of the insurance card. Here's the back of the insurance card. Same thing with the patient ID. Front, and then what you'll do, if needed, put a second photo of that ID card if it's kind of, you can't tell. Now, I always like to see people put two here. It says, if needed, but put it the same image that you found was good back in that category as well. So I want to see 4 pictures here. The front, back. So 4 pictures. There's additional space if you need them. Now you're at the end. You can't go any further. So what you're going to do now is you're going to scroll up to the first signature. And you do not need to read all of this to the patient. Offer it to them, but don't force them to read it. One thing that you want to just basically tell them is, so listen, I need your signature to consent to me submitting your samples to the lab. It's everything I told you it was, nothing more, nothing less. No one's going to keep your DNA. It's going to be destroyed. No agencies, government, or otherwise have access to it. The results come directly to you. Then you're basically initialing off on, you're releasing us from any liabilities. Okay? Now there's one that I do want you to look at, though, and that's this one. It's defaulted checked yes. Okay? And it says, I understand the following information regarding the use of the specimens for research. Our lab's committed to improving genetic testing for all patients and contributing to scientific research, such as like the Genome Project. If left blank, consent is interpreted as no. It's defaulted to yes. Please make sure you ask them, because If they don't, then click it. Don't just assume that they want it. Now, their information that they're going to be using for research is not anything that's identified. It doesn't have their name, address, phone number. Nobody knows whose it is. It's just used for research. And the lab releases. So what they'll do is they'll sign one time. And you draw it on your computer with a mouse or on your tablet or whatever, and you'll enter their name. If it doesn't show up that you can do it, make sure you're clicking the draw portion. And then you'll apply. And then also you'll get them to initial one time. Draw. And apply. Now you're going to notice something that happens here. If you're not comfortable in just having them sign and click once, then go ahead and read them everything if you want to. Every time there's an initial, you can read them a sentence, and boom. Boom, boom. It's all you're comfortable. It's all how comfortable you are. Okay. Boom, boom, boom. Signature. And just keep rolling up. Make sure everything's filled out. Another signature. Now notice this. Top right-hand corner. You need 27 more fields are required before you can complete this thing, because I haven't filled any of these required ones out. Once this goes down, down at the bottom of the screen, it'll be a complete button or submit button. And when you are there, you can click that. Then this is important. You want to write this down. It's going to pop up a window. It'll say, to complete signing, enter email address. And this is not your email address or theirs. This is the order email address. So you'll put in order, that's ORDER, underscore status, it's STATUS, so it's ORDER underscore STATUS, that's order underscore status at AdvantageMedicalTesting.com, and then complete the document. And that is the combo. Now, if you have a PGX application, it should look very familiar because it is. It's the same form except for without the cancer. So PGX only, you can see everything here is the same. The medications are the same. The pictures and the ID card are the same. And then it's a short form. And funny enough, the cancer application is going to also be the same as the CGX part, only the original vital statistics. It just skips right to the CGX. Okay? Simple. Okay, so that is submitting the combo, the PGX, and the CGX form. So let's look at a little quick video of how to swab. Maybe. Maybe not. The technical difficulty here. There it goes. All right, like we stated, this is for the OraCollect, and this is also the same for the cheaper version, the white swab. This is the blue and purple swab. So we want to have people refrain from eating, drinking, smoking, or putting anything in their mouth for basically 30 minutes. And what's going to happen is you're going to open up the package for them. It's a good idea to have a pair of gloves on. You'll open it up, and then you'll just present it to them and let them pull it from the container. Don't follow this instruction. Let them pull it. Now, it says that they should take caution in putting this in their mouth, and that's absolutely true. If somebody's got shakes or spasms or anything like that, caution them ahead of time. Say, listen, be careful when you put this in your mouth. And what they're going to do when they put it in their mouth is they're going to act like they're brushing their teeth, but they're going to put the swab between their gum and their cheek, like you can see right here. Now, it says 10 times. Change that to 10 seconds. We want them to vigorously rub their between their cheek and gum, and we want them to twist that swab around a couple times while they're doing it on each side of their mouth. So they'll repeat this process for 10 seconds, count to 10 like 1, 1,000, 2, because the more DNA you get on the swab, the better the ascension test will be and the smoother we will sail. Okay, once the swabbing is completed, you'll take it from them with your gloves on and you'll unscrew the top cap, which has the Q-tip sticking out. And what you're going to do with that is you're going to put that into the drying agent that's in there, screw the cap tightly, and shake it. You're going to shake it for about 15 seconds, not 15 times, again, 15 seconds. Now what that fluid is actually doing is actually drying the DNA sample. Looks like we're making it more wet, but it's not. Okay. There's also that video on the training portal. After you take the sample and shake it up, now you need to label it. So you need a fine magic marker. And you can see here, there's a spot on the blue swab, purple swab, for you to do so. First initial dot last name, and their date of birth goes below it. You may or may not get biohazard bags with your swabs. If you do not get biohazard bags, just get a regular Ziploc, quart-sized, and do the same thing to it. First initial, last name, date of birth below it. The white swabs don't have a label, so you can try to write on a bottle, but what I'm telling people is to just go ahead and get some of those cheap at the dollar store mailing labels, blank ones, and just put them on the tube and do the same thing. First initial, last name, date of birth below it, the bag, Ziploc or biohazard bag if they came, first and last name, date of birth below it. Once those bags are sealed, you'll put them in a box, because I want you to send the swabs off. You do one test a day, send it off at the UPS store. If you do 10 swabs a day, put them in the same box, but only go to the UPS store one time. Okay. Now, this is how you package them. We've talked about how to label them, and you get prepaid shipping labels. Just take the first time you go with that label, it's you'll just take it into the UPS store with your taped up box. It can be any kind of box. It doesn't have to have any special markings. Seal it before you hand it to the UPS people, and hand them the shipping label, and they will show you for the first time, or as many as you need, how to actually affix the packing label to the box. Now, in the box, so before you do that, I should have told you this, put the swab packing slip in the box. This is going to list all your swabs. So I'm going to go back to the website real quick. Apologize for jumping forward. We're going to go ahead, and before you go to the UPS store, you're coming back to the office. Come to your agent portal, and there's a swab packing slip. You fill out the required fields. It'll tell you a total number of swabs. So if you've got 6 swabs, 6. The date that you're shipping it, and the tracking number, which is listed on the bill that you take into UPS, is prepaid. So then from here, you'll type in the name. And what kind, his date of birth, of course. And what it was. If it was a combo, you're going to type his name in there twice, because it's a combo, it's a PGX and a CGX, right? So you go John Smith. And CGX. So you'll do that for all the swabs that you're going to ship in that day. What you do from this point is you print it as a PDF for the record, and you print it as a hard copy, fold it up, and put it in the box with the swabs. This is a great emergency backup for the lab. There right now is about 500 swabs at the lab that have went into the garbage because people did not label them. Silly enough. That's the packing slip. So print a hard copy for the box, print a PDF, and save it on your device. Because the next step, when you're done, is to fill out a production report. Put the date that you're shipping it, your name, first and last, your ID number, your state, and from here, you'll notice that it has PGX, CGX, and combo. So this will be different than your packing slip. So you'll actually write out this guy's name. Oop. Capital letters. And instead of putting his name twice, you'll just go combo. Now this will change when we have the other tests as well. Now if you did another one that day and it's on the packing slip, you'll just keep adding. Then it'll ask you to upload your packing slip. And when you hit submit, it goes to the right place. Okay. There it is. There it is. Here's the flow. So this is what happens. You're on the field and you do all your work and you send a swab off. Once you hit submit on the electronic application, quality control already has it. And then they will go to work. And then the swabs will show up a few days later. By then, in a perfect world, the doctor will have the application signed and ordered. And then they release it for pay. So I need to clear a couple things up for pay. We do not get paid by Medicare in any way, shape, or form. Okay? We get paid by the lab. We are hired by the lab to market these tests. The lab bills Medicare directly and pays Medicare. Medicare typically takes anywhere from 90 to 180 days to pay a bill, and so therefore we're not paid from Medicare. So you can see this, all the approved swabs that are, all the tests that are approved. Now that's not completed. That's after they pass the Ascension test. The doctor signed off on them, such and such. Everything that we receive as an indication that's approved by the 15th of the month is paid on the payroll is initiated on the 30th. Same thing with 30th and 15th. The cycle, this is our constant battle trying to get this down, but currently it's right around 7 business days at the longest part. Sometimes they're 3, sometimes they're 4. So that's out of our hands. Okay. So at this time, I'm going to go ahead and open up to questions so you can unmute your phones one at a time.